Hi, welcome to Healthy Living. My name is Amy Bouton. I'm with St. Tammany Health System. And today we're going to talk about palliative care, home health, and advanced care planning. And we want to talk about that because we have a wonderful team that works with us on all these fronts. And my first guest is Kathy Ann Howard. Kathy is a nurse practitioner for palliative care with St. Tammany Health System. So thank you so much, Kathy, for joining us today.
Sure. Thank you for having me.
You're welcome. So you work with the palliative care team at St. Tammany Health System. We are going to dig into what is palliative care, what does it mean for me as a patient, what does it mean for me as a physician. But first, I want to talk about a little bit of what you do and your personal life. And you do have a personal connection to palliative care that you didn't maybe have, say, a couple of years ago.
Yes.
So can you elaborate a little bit on that?
Sure. As you said, I am a nurse practitioner and I do work with the palliative care team here at St. Tammany, but I'm also a breast cancer survivor. In 2022, I was diagnosed with stage 1A breast cancer, and I ended up having to do all the things, mastectomy, radiation, and then continue treatment. And so that has really given me a really good perspective on the type of care and some of the struggles that our patients go through when they are diagnosed with cancer. And I've used that experience to incorporate into my practice now and help me be, a much better provider in terms of understanding like the patient's experience.
Yeah, so we were talking about it, and it's almost like you know what you're doing. You're a palliative care nurse practitioner, so it's something you've been doing for years, and you've been providing this care. But now you have this kind of 360-degree view of it from the inside and out, and you know what that patient is feeling,
yes,
or could be feeling.
Yeah.
So how has that changed your kind of, I guess, care philosophy?
Yeah, it helps me to be a lot more empathetic. There's so much anxiety that's associated with this diagnosis because even if you have a cancer that's treatable or curable, there is some changes that could happen in your life, whether it's a body image change,
right.
Whether it's the side effects from the treatment, you've lost your hair, so I really have a lot more empathy, and it helps me to also be the very best at trying to care for these patients.
So let's dive in a little bit about to what you actually do, because palliative care can be mysterious to some people. We hear about it. People have theories about what it is and what it means to them as a patient. So give us kind of in a nutshell, what is it that you do? What's palliative care? Why would I come to you for that?
So we tend to say a lot when we see patients that palliative care is an extra layer of support. We like that word, and because that's what we do. It's supportive care. We focus a lot on symptom management, helping patients to cope with the challenges of a serious illness or irreversible condition.
Okay.
So a lot of what I do is therapeutic and supportive to the patient.
And it's not just for cancer patients.
No, it's not. It's for anybody that has a chronic condition or irreversible illness or serious illness. And those patients typically would be struggling in some way. So for maybe our heart failure patients, they're struggling with the fatigue and shortness of breath. For our cancer patients, it might be pain. For some of our older patients who have dementia, it could be depression. And so we help to manage the symptoms that gives the patient the best quality of life.
Okay. And we have done the whole health system was challenged to learn more about palliative care this year. Every year we are. And one of the cases that I saw in particular was also a breast cancer survivor, but she had a side effect from her years of chemotherapy of neuropathy in her fingers. And I think she was a seamstress.
Right.
So she basically said palliative care saved her life. So what is that approach? It's basically, I guess we were saying it's a symptom that you might have that reminds you of that illness.
Yes.
But you might not necessarily have to live with it.
Yeah, you don't have to live in a way that prevents you from getting to doing the things that you love doing. I typically, when I see patients, I always ask them, what is your illness preventing you from doing? Like, what is the one thing that you may love to do that is preventing you from doing? And that's what we want to help the patients, for that seamstress to get back to doing what she loves. That might be sewing, for somebody else, it might be, I want to be able to go fishing. I want to spend time with my grandchildren without being so short of breath. And so that is the idea, is treating those symptoms, even though we may not be able to cure the disease, but we can help you live a quality life.
And your team, you don't take the place of a primary care or an oncologist or a cardiologist or a neurologist. You are, like you said, an extra layer of support. So how do you integrate your care into their care plan?
Yeah, that's a good question. It's really collaborative. It's support not only for the patient, but I like to say it's also support for the providers. We have a little bit more time to spend with the patient to focus on these things, where they get to spend the time focusing on managing the chronic condition. And so we don't replace them, but we really actually add to what they do, and they actually have better outcomes when their patients engage with palliative care.
Okay, that is that makes it so much more clear to me, even knowing about it. So I hope that it's making it more clear to our audience. What would be a factor that would maybe exclude someone from palliative care? Would anything exclude you from palliative care?
That's a really interesting question. I would want to say no. I think anybody could see palliative care. We could see patients across the trajectory of their illness. At any point in their illness, we could see a patient. So, I would say I don't think there's anything that would actually exclude you from getting in with us. Yeah.
So how would I find you? How would I say, I want to go see Kathy for some palliative care consultation?
So typically the referrals come from the providers. We get a lot of referrals from the primary care doctors or the specialists, the pulmonologists, the cardiologists. Typically they would send a referral asking us to engage with these patients to help manage some difficult symptoms. So it usually is through a referral from your provider.
Do you have any favorite stories, good success stories that really kind of resonate with you and stick with you?
Obviously I spend a great chunk of my time now at the cancer center and taking care of a lot of our cancer patients. And I feel like for me, success is when I see patients being able to do some things like coming in the door in a lot of pain, really struggling, and then being able to come back and tell me, I was able to go in my garden today. I was able to, sit at the table and have a meal with my family. So I think, just about all of the stories are success stories for us.
That's good. Some of those little things you take for granted.
Yes.
So
for sure.
That's good that you can restore people back to some of those things. Is there anything else you want to add?
I think, what the work that we do here with palliative care is such good work. I am truly passionate about it, definitely from my own journey with having a serious illness, and for the time that I've spent with these patients. A lot of our patients not only have serious illness, but they're also older, and it really brings back a lot of dignity to our older patients, who in some ways might be forgotten. So what we do here is really, really special work, and we would love the opportunity to take care of this population.
Wow, that's wonderful. Thank you so much for what you do.
Yeah, thank you for having me.
And thank you for staying with us, and stay with us a little bit longer, because when we come back, we're going to have Kelly Rogers. She's the Director of Home Health Services for St. Tammany Health System. We're going to talk a little bit about home health. We'll be right back.